Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about urine calcium. We will also see about this random as well as 24-hour urine collection and the precaution we need to take when we are collecting a sample for urinary calcium. So you all know that calcium is a very important mineral in our body. Urine calcium test measures the amount of calcium which is excreted from the body via the urine. So this calcium, which is a very important mineral in our body, you know that 99% of it is seen in the bones, and the rest of the 1% is the one which is distributed outside the extracellularly, and the calcium which is present in the bones and the teeth is mainly in the form of calcium phosphate. So this calcium 98 to 99% is present in the bones, and 1% you will see that it is distributed as 50% as ionized calcium, 10% of which is bound to phosphates, bicarbonates, sulfates, and 40% is bound to proteins. So this 1% is the one. Here you will see that this ionized calcium is the one which is metabolically active. So 99% in the bones, 1% in the soft tissue. So you will see that the extracellular fluid or the plasma, it will have this calcium, out of which majority 55% is ionized calcium, and this is active form. 40% is protein bound and 5% is complexed calcium. So calcium in the blood, when we talk, the normal range would be anything from 8.5 to 10.5, out of which 10% would be bound to the anions. 40% would be biologically, 40% would be protein bound. So it could be albumin and globulin. 80% is bound to albumin. And the remaining 50%, 40 plus 10, 50, and the remaining 50% is the free or ionized calcium. Hence the ionized calcium range would be anything from between 2.5 to 5.6 milligram per deciliter. So it would be almost half. And this biologically active calcium is regulated by the parathormone, vitamin D, calcitonin, etc. The calcium absorption and balance in the body depends upon the calcium intake, the kind of diet what we take. Usually the dairy products are rich in calcium. The absorption of calcium from the intestine, the excretion of the calcium from the kidneys and through the intestine via feces. So all this will maintain the calcium homeostasis. So the metabolism of calcium depends upon the absorption of calcium. There are few factors which will affect the absorption and delay the absorption, and then it is excreted in the urine and feces and sweat. So calcium absorption most of the time 90% happens in the small intestine, and the remaining whatever 5 to 6% is there, that happens in the large intestine. So this happens via active transport and via passive diffusion. So when we have a lot of calcium in the diet, then they're more likely it is absorbed via the passive diffusion in the intestine. And the 90% of the calcium whatever is absorbed from the duodenum and jejunum, that is dependent upon the calcitrol and the intestinal vitamin D receptor, which happens via the active transport. So here you will see that it is dependent upon this vitamin D receptor for absorption. There are certain factors which help in the absorbing the calcium, like vitamin D, parathormone, acidity in the stomach, the milk lactose, lysine, arginine, exercise. Certain factors delay the absorption of calcium, oxalates, phytates, excess phosphorus, stress, caffeine, lack of exercise, etc. So kidney plays an important role in calcium homeostasis. When there is normal blood calcium level, most of the calcium is entering the glomerulus and it is reabsorbed from the tubular system, returning to the blood so that we preserve the level of calcium. When the tubular reabsorption of the calcium decreases, we lose the calcium via urine. So excretion of calcium, you will see that 60 to 70% of calcium is excreted in the form of stools. 50 to 200 milligram per day of calcium is excreted in the urine, and around 15 milligram per day of calcium is excreted via the sweat. So in the urine calcium, the normal range per 24 hours would be around 50 to 200 milligram per day. So these are the hormones, the parathormone, the thyroid gland and the kidney, which will secrete PTH, calcitonin, vitamin D respectively, and regulate the calcium, that is the ionized calcium or the active calcium. So whenever the calcium level is increased in the blood, thyroid gland will release calcitonin, and calcitonin will decrease the level of calcium. How it will do? It will reduce the absorption of calcium from the kidneys, reduce the absorption of calcium from the intestine. When the level of calcium decreases, the parathormone comes into play. It will increase the level of calcium. How it will do? It will increase the resorption of the bone. It will stimulate the osteoclastic activity. It will increase the reabsorption of the calcium from the intestine. It will increase the reabsorption of the calcium from the kidneys and increase the level of calcium in the blood. So this I have told you, around 50 to 200 milligram of calcium is excreted per day in the urine. So mostly calcium is lost in the stool. I have told you 60 to 70%. A minimal amount, around 50 to 200 milligram is excreted in the urine. In hypercalcemia, the level of calcium in excretion in the urine will increase, and in hypo, the opposite happens. So urinary calcium excretion is dependent upon the dietary intake of calcium. I have told you, whenever there is adequate intake of calcium, the amount of calcium whatever is there, it is all are reabsorbed, and a very small amount is excreted in the urine. The body tries to conserve the calcium. So increased urinary calcium will happen whenever there is increased intestinal calcium absorption, or suppose if there is a defect in renal tubular absorption, or there is loss or resorption of the bone. So, in primary hyperparathyroidism disease, patient will have high urinary calcium because the increased calcium gets excreted in the urine because of high level of calcium. The kidney will not be able to handle it. So, increased urinary calcium can happen in hyperparathyroidism. Majority of the cases, this is the most common cause. In sarcoidosis, when there is hypercalcemia, breast cancer, urinary bladder cancers, etc., they cause hypercalcemia because of this parathormone related proteins, and they can increase the level of calcium in the urine also. In the vitamin D intoxication, that can increase the level of calcium in the blood, and hence increased excretion also happens in the urine. Thyrotoxicosis, wherein there is increased resorption of the bone which is happening. Similarly, in prolonged immobilization, it will cause resorption of the bone and hypercalcemia, and increased calcium will be excreted in the urine. Decreased urinary calcium, sometimes in cases of preeclampsia or vitamin D or hypoparathyroidism or renal osteodystrophy. There is issues with the kidney, there is problem with the kidney, so there is a renal osteodystrophy, or there is a malabsorption, there is a celiac disease, there is steatorrhea, there is PRU. The patient will not be able to absorb the calcium, adequate amount of calcium, and hence the level of calcium will be low and less of calcium is excreted in the urine. So, and familial hypocalciuric hypercalcemia, that condition also you will get less of calcium in the urine. So these were few of the causes for hypo as well as hypercalciuria. So we can test this calcium in the urine either with a 24-hour urine sample or with a random sample. So whenever we do a 24-hour urine sample, we take an acid washed bottle. We add 10 to 20 ml of HCl and wash it, and then give it to the patient. We acidify the urine to pH which is less than 2, because whenever we add hydrochloric acid to this urine sample, this is added to prevent calcium salts from precipitating. Okay, calcium, phosphates, magnesium can precipitate in urine when the conditions are alkaline. So suppose if the pH is high or there is an alkaline condition, calcium can precipitate and we might get a wrong result. We might estimate it as a low calcium. So that this precipitation doesn't occur, we estimate the exact amount of calcium. We add this 6 ml of hydrochloric acid. Whenever we give this such kind of acid washed bottles to the patient, we are supposed to tell the patient that this bottle is acid washed. Do not pass urine directly into the bottle. They can collect it in a container and then transfer it into this bottle to avoid the burns. So we can do both. We can do 24-hour urine collection and we can also do a random sample collection. So the normal would be anything between 50 to 200 milligram of calcium per day. The causes of increased calcium levels in the urine, the causes of decreased calcium. So that is all about urinary calcium, causes of hypercalciuria and hypocalciuria. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.